Thank you for joining us on Crossroads Politics here on WTHR+. I'm Emily Longnecker. Dustin Grove is on vacation. We start this week looking at Indiana's hospitals and how there could be fewer of them in the coming years. That's because of cuts recently signed into law by President Trump. The National Democratic Party has already taken action. The DNC paid for a billboard that blames President Trump for recent cuts to services at Columbus Regional Health. Voted overwhelmingly 60% to elect the president. This billboard near Columbus Regional Health has a message for those voters.
I think it's really important that we tell people, it's okay if you voted for Donald Trump, but we want to point out that you voted for Donald Trump, you didn't vote for this, and we know that, and you didn't vote to have your services cut.
Democrats are talking about what they say will be the negative impact on rural health care, with the president's tax and spending cuts bill becoming law. Last month, even before the new law, the Columbus, Indiana hospital announced it was cutting some services like its inpatient rehab unit, outpatient orthopedics, and their athletic trainer program. The hospital cited what it called, quote, unprecedented challenges and financial hardships experienced by health systems across the country, noting rising supply costs, legislative scrutiny, and federal and state funding cuts. This week, in a statement, the hospital said it didn't have advance notice of the billboard going up or that its recent cuts would be referenced. The statement went on to say in part, quote, the potential of large cuts to vital governmental payer programs like Medicaid pose catastrophic and potentially irreversible repercussions to providers like Columbus Regional Health to deliver the services our community needs. In Bartholomew County, more than 19,000 people are on Medicaid, according to the state's Medicaid enrollment dashboard. That's 1/4 of Bartholomew County's population. Community advocates say under the new law, there's a greater risk of people getting kicked off Medicaid because of more frequent work reporting requirements that could lead to paperwork errors.
Those folks still have bodies, they still can get sick, right? The cost of their care is then going to get passed on and be uncompensated to local providers. And that is potentially and likely not economically sustainable.
The new law includes a $50 billion rural hospital fund to help, but how that will get dispersed is still unclear.
It's better than nothing, I suppose, but it is a temporary, source of funding and revenue within the context of colossal changes.
On Thursday, Governor Braun blamed a broken system as the reason rural hospitals are struggling.
We got 80 to 90 rural hospitals hanging on by their fingernails. You got 5 to 7 very rich systems. And if you run like an unregulated utility, something's going to have to be done to make sure we have good care and access in the rural community. And part of that responsibility is going to have to be on the shoulders of the rich hospital systems.
According to the Indiana Hospital Association, right now, 27% of the state's rural hospitals are operating at a loss. The Indiana Hospital Association issued a statement calling the cuts to Medicaid drastic, saying they will only exacerbate the financial strain already being felt by many of Indiana's hospitals, including the ones that serve the state's rural communities. Some economists estimate 12 hospitals in Indiana could be at risk for closure in rural areas where residents rely heavily on Medicaid. Columbus Regional Hospital was not on that list. Those federal cuts weren't the only thing out of Washington the governor weighed in on this week. Braun also had something to say about the so-called Epstein Files. Epstein, folks may remember, was a financier and convicted child sex criminal. He's accused of running a human trafficking ring that abused as many as 200 girls. He was arrested in 2019 on new charges and killed himself a month later. Now, many Republican members of the House have been calling for the files from the investigation into Epstein to be released. But last month, President Trump announced the case was closed. Epstein had killed himself and said there would be no releases. That did not sit well with representatives on both sides of the aisle who were clamoring to demand the DOJ release the files, but House Speaker Mike Johnson recessed the House before that could come to a vote. Then on Wednesday, the Wall Street Journal wrote a story saying that back in May, the Attorney General told Trump his name was in the Epstein files. The House Oversight Committee voted to subpoena Ghislaine Maxwell to testify from prison. A lot of controversy, so I asked Governor Braun where he stood on the issue.
What have I been for? Full transparency. I think the Speaker and the Trump administration are out there now where they're for it fully. I think they kind of were all along. It begged the question, why wasn't that done in the prior 4 years? Now it seems like it's got a heavy political overtone to it, but I'm for full transparency. I think we're going to get it. I think the American public deserves it. We'll wait and see.
So Governor Braun weighing in there, saying he supports full transparency when it comes to these files. And that's certainly something we've heard a lot in recent weeks, both from members of Congress and the public. So certainly something we will continue to follow. This week, we also learned the governor's plans to power economic growth in Indiana.
Data centers, chip factories, battery factories, they use a lot of electricity.
Coming up, Governor Braun considers a nuclear option to meet the state's needs. But first, could the federal government house immigrant detainees at Camp Atterbury? What an Indiana congressman has learned and the questions still unanswered, next on Crossroads Politics. Welcome back. This week we learned new details about plans to use Camp Atterbury to house ICE detainees. I spoke with Democratic Congressman Andre Carson, who told me he's learned Camp Atterbury is preparing to house 1,000 people. The congressman did not say how he learned of that number, but said when it comes to other questions he had about these plans, he still had not received those answers. Carson sent a letter to the Department of Homeland Security last month asking for more detailed plans after learning Camp Atterbury could possibly be used to hold ICE detainees. Last week, a different letter confirmed those plans were in the works. The letter, signed by Secretary of Defense Pete Hegseth, says such use, quote, will not negatively affect military training, operations, readiness, or other military requirements, including National Guard and Reserve readiness. For Congressman Andre Carson, questions about that remain.
I stand firmly in my conviction that Camp Atterbury is for military training operations, unless there are exigent or emergency or national security concerns. And as a senior member of the House Intelligence Committee, I'm always concerned with issues of national security. So some of the questions we need answers to must be answered. We cannot allow this Hoosier facility to be turned into another alligator Alcatraz.
The ACLU of Indiana also expressed concerns, calling the plans to use Camp Atterbury to detain migrants as poorly conceived, saying in a statement, quote, this kind of mass detention always results in significant rights abuses for the people being detained. Camp Atterbury is located in Republican Congressman Jefferson Shreve's district. Shreve issued a statement saying in part, I support the use of Camp Atterbury as part of our national effort to detain and remove criminal aliens who entered our country illegally. Indiana Attorney General Todd Rokita also expressed support for using Atterbury for housing ICE detainees, saying his office is ready to support federal efforts to enforce immigration laws. Rokita's statement said in part, quote, using Camp Atterbury to securely detain illegal aliens pending immigration proceedings or deportation sends a clear message. Indiana will not tolerate lawlessness. This isn't the first time the site has been used to house people. Camp Atterbury has also been used to house evacuees from Afghanistan and refugees from Ukraine, but never ICE detainees. And Congressman Carson also said he planned to ask more questions about these plans during an intelligence briefing scheduled on Monday. Later this week, a spokesperson for Congressman Carson said they had no information that was new to share. And this week we learned there's a growing push to bring nuclear power plants here to Indiana. Governor Braun's administration wants to boost power production and says nuclear energy could be the solution. This comes as industry leaders arrive in Indy this week for a nuclear energy forum. Rich and I talked to the governor and other stakeholders about the push for nuclear power.
The demand is on for more energy, turned up by AI and companies looking for places like Indiana to build data centers.
Companies want to come here. None of us as states have kind of figured out how you're going to get from where you have no extra capacity really to spare, who can get it first in a way that can accommodate all these opportunities.
Governor Mike Braun believes nuclear energy is the solution. A Purdue University study conducted for the state concluded that new generation small modular reactors, or SMRs, are a viable option for carbon-free, always-on electricity in Indiana. The study identified 8 coal plants that could be converted to nuclear. Indiana Michigan Power has already applied for a $50 million federal grant to develop an SMR to replace the coal plant in Rockport on the Ohio River in Spencer County. SMRs are operating in other countries, but none yet in the United States.
It simply is not viable in terms of the private market financing, and ensuring nuclear power requires significant subsidies from American taxpayers to deal with the waste, to deal with the proliferation issues. And then when it comes to the construction, financing, planning side, guess who's on the hook for all of those costs? Ratepayers.
Customers will likely see their electric bills increase, but new law in Indiana requires that companies needing large loads of energy pay 80% of the cost to build new power plants.
A lot of people are concerned that data centers will use all of our electricity and water and that our citizens will be left high and dry. That is not the case. We're inviting data centers to come to Indiana, those who really want to partner with Hoosiers in order to bring us the additional generation, transmission, and even water capability that we will utilize in the state for generations to come and help pay for it so ratepayers don't have to have that burden.
The governor believes a nuclear power plant could be operational in Indiana in 7 to 8 years if Indiana acts now.
So just because nuclear does take longer to build out than some other types of resources doesn't mean that it's not viable or that we shouldn't be starting today. As Governor Braun has identified, we have an opportunity before us, and it's whether Indiana is going to follow or lead.
The history of nuclear energy and weapons around the world always brings concerns about safety. This is the same technology that's used in submarines and aircraft carriers, but at a larger scale. The Purdue study says SMRs have inherent advanced safety features. Now, Purdue is exploring with Duke Energy a small modular reactor that could power the entire campus and region. And this came this same week. The Citizens Action Coalition reported that Indiana's 5 big investor-owned electric utilities raised bills by 17.5% in just a year. That's an average of $28 more a month. Some families are paying almost $50 more a month than they were last year. And AES and Duke Energy are already applying for further rate hikes with the Indiana Utility Regulatory Commission. That does it for this week's episode of Crossroads Politics here on WTHR Plus. For Dustin Grove, I'm Emily Longnecker. Thanks for watching. We hope to see you next time.